Today's question is, can I switch my Medicare supplement plan at any time? It is a great question. It is so confusing. The rules of Medicare and when you can do stuff, when you can't do stuff is so confusing for people. A lot of times people think the annual enrollment period, the time when you see all those TV commercials, when you are getting mail, phone calls, they think that's the only time they can switch a Medicare supplement plan. Well, actually, you don't have to wait around to the open enrollment to switch. You can do it any time. Believe it or not, you can do it at any time. But the thing is, it may not be simple to switch from one to the other. There are specific rules. Today, I'm going to break down when you can switch your Medicare supplement plan, and I'm going to go through some specific examples, share with you some mistakes that people made when it comes to switching their Medicare supplement plan. And you're going to want to stick around to hear the stories because you could be making these mistakes by thinking, I'm stuck in the plan, or I have to do it this way or that way. So I'm going to make it clear to you so you understand that yes, you can switch your Medicare supplement plan at any time. And at the end of this video, I'm going to offer you a free gift. It is hugely beneficial. It is something that really helps people, whether you're going on Medicare, you've been on Medicare for a while, you're going to want to stick around to get the free gift, okay? So we'll go over that in a little bit. Yes, you can switch your Medicare supplement plan at any time. You don't have to wait around for that annual enrollment period. The catch is, unless you're in your open enrollment timeline, you have to go through an application process, which includes underwriting. Okay, so open enrollment for Medicare supplement plan is when you're turning 65, going on Medicare for the first time. You have a 6-month window to change from one plan to the other. But for most folks, 6 months is the only time they have that guarantee issue to go from one to the other. For most folks, they're going to have to go through the underwriting process of changing their Medicare supplement plan. So I want to give you 3 examples of 3 different people that I've helped change their Medicare supplement plan at different times. The first is a client who was referred to me. I'll call them Ann and Pete, just to change the names. But Ann and Pete, they were referred to me by one of my existing clients because they were looking to save some money on their Medicare supplement plan. They were paying too much money. They had been on Medicare for a couple of years. Their financial advisor was the one who assisted them with the enrollment to their Medicare supplement plan. So at the advice of their advisor, they chose a really big company to be their Medicare supplement plan, and they were paying big dollars for that. So they were asking around, they were asking friends, and they said, are you guys paying that? How much do you pay for yours? So they came to me looking to save money. And I went through an application with them. I saved them about $1,500 a year. Now, keep in mind that's both of them together. So, a little over about $700 each, about $50 a month or so each on their Medicare supplement plan. That's a nice savings. By the way, I would like to keep $1,500 in my pocket. I'd rather spend it on something else rather than insurance. But so we were able to save them some big dollars. And here's the thing. We have to go through an application with them, and the application included health questions. They didn't have any real health issues. Took a couple of maintenance meds. They weren't actively treating for anything. So their application went really smooth, and we were able to move them to the lowest cost insurance company available for the Medicare supplement plan, saving them big dollars. Now, the mistake that they made was they took advice from the wrong person. They were getting their Medicare supplement plan from their financial advisor, who really has their finances in mind when they set them up on that. So you don't want to choose the wrong advisor. That's one little tip that I want to make sure you understand. You should be getting help from Medicare, not from your financial advisor, unless they're specializing in Medicare. Another couple who was referred to me, Mary and Joe, they weren't as lucky as our first couple, okay? So they also came as a referral, Their insurance premiums, their Medicare supplement premiums were going up, but they had a lot of medical issues. And when they first chose to go on Medicare, they were do-it-yourselfers. So what they did was they took it upon themselves to enroll themselves in their Medicare supplement plan with the biggest name insurance company available, not realizing that they were overpaying on their premiums. Okay? So when they came to me, again, we went through that application process. They had a few underlying issues. And because of that, they were actively treating for things. I wasn't able to help them with changing their Medicare supplement plan and save them the big dollars like we did for Ann and Pete. Okay, we just weren't able to do that. But we were able to do a few other things for them, look around, and we're keeping them in mind to shop every year to see if maybe some of the underlying health things have subsided. Okay, so that's really mistake number 2 that people make. They try to do it themselves and they don't realize that they're not an expert. They're not an expert on Medicare, and they didn't shop around properly, and they locked themselves into a plan that was going up a couple of times a year, and they were overpaying for their plan. So the third client I want to talk about, this is a client who started out with us. They are good friends of ours, actually. They owned a business, and I'm going to call them Kitty and Joe. Kitty and Joe, they owned a business. They were paying a lot of money for their health insurance before they went on to Medicare. And not only were they paying a lot of money for their health insurance, but it was no good. It was crappy insurance. It wasn't good insurance. They had big out-of-pockets. So when they went on Medicare, they were so happy that they were paying not even a quarter of the price to be on insurance, and they had really no out-of-pockets. They enrolled in a Medicare Supplement Plan G, and it pretty much paid for all their stuff. Now, they had a couple of issues medically, but they were just so happy that they were paying less money than where they were before. That every year we would come to them and we would say, hey, you guys want to switch? You want us to look around? They're like, no, we love our insurance. It is so, so good, okay? And then finally, when the premium went up like double digits, I'm like, you guys, you got to change. We got to look around. So when we started to look around, they had some underlying health issues, and I wasn't able to move them to the lowest premium available, okay? So I had to shift them to save them some money. They kept the same coverage. Now keep in mind, I was shopping for people with the same exact coverage, a different insurance company. So they didn't lose out on the coverage, but they were lowering their costs. I couldn't lower it to the completely lowest company available, but I was able to lower it somewhat. So we were able to save them about $800 a year, which is still pretty nice. Not as good as our first couple. They were saving like $1,500 a year. But the lesson here, or the mistake number 3 I want to just add in there, is that don't wait too long. Shop every year. You should be taking a temperature of your plan. As we get older, we don't get healthier. There's more stuff going on. You may have things happening, physical therapy, people develop COPD. There's a lot of chronic illnesses that pop up as you get older. And if you wait too long, you may not be able to change. Can you change your Medicare supplement plan at any time? Yes, you can. And you should check it every once in a while. We like to look at it at least once a year, every couple of years, just to make sure you're not stuck in the plan that you originally started with, and save you some money. If you found this information valuable, if you're looking for more information on Medicare in general, you want to click on our free report. We're really excited to offer this to you. It is a free report, 7 questions every baby boomer needs to ask before going on Medicare. It's loaded with a lot of little nuggets, especially for people who have been on Medicare for a while, or if you're brand new. You may not have realized all of these little things that are important. You'll learn about Part D drug plans. You're going to learn about Medicare supplement plans versus Advantage plans, and the timelines of when you can do things. So go ahead and click on the free link to get your free report.